Hey guys. Hey!
Today, we have to continue the question paper of February 2013.
Okay, then now we shall discuss the second essay question.
Can you read the essay question? Sure, explain in detail about right lung and its bronchopulmonary segments.
The lung is the essential organ of the respiratory system.
The lungs are spongy, expandable organs that occupy the thoracic cavity.
The organs are roughly conical in shape and are divided by fissures into lobes.
The right lung is one of two lungs, located in the right hemithorax on the right of the heart and mediastinum.
The lungs are covered by a thin tissue layer called the pleura. The pleura contain two layers, the outer parietal pleura and the inner visceral pleura.
The pleural cavity is the fluid-filled space between the parietal and visceral pleura.
The right lung has 3 lobes and 2 fissures.
The lobes are then further subdivided into bronchopulmonary segments. The right lung has 10 segments.
The right lung has 2 fissures. They are oblique fissure and horizontal fissure.
Both fissures divide the lung into 3 lobes. They are superior, middle, and inferior lobes.
On the medial surface of the lung, the oblique fissure can be seen at the hilum of the right lung.
The horizontal fissure has a much shorter course than the oblique fissure.
The superior lobe of the right lung is located above the horizontal fissure and anterosuperior to the oblique fissure.
It contains the apex.
The middle lobe is the smallest of the 3 right lung lobes.
It is caudally related to the horizontal fissure and anterior to the oblique fissure.
It is cuneiform in shape and involves the anterior basal aspect of the lung, the antero-inferior part of the costal surface, and the inferior region of the anterior border.
The inferior lobe accounts for the majority of the lung surface volume. It is situated behind the oblique fissure.
This lobe includes the posterior-inferior parts of the costal and medial surfaces, and the entire lung base that is posterior to the oblique fissure.
The hilum is a depressed surface at the center of the medial surface of the lung and lies anteriorly to 5th through 7th thoracic vertebrae.
The hilum is visible as a triangular section at the inner midpoint of each lung.
It is the space where vessels and nerves pass from your bronchus to your lungs.
The right hilum is caudally related to the terminal azygos vein and posteriorly related to the right atrium and superior vena cava.
The bronchial artery is the main source of blood supply for the bronchi.
The bronchial arteries supply the lungs with nutrition and oxygenated blood.
A bronchopulmonary segment is a portion of lung supplied by a specific segmental bronchus and its vessels.
The segments are separated from each other by layers of connective tissue.
There are 10 bronchopulmonary segments in the right lung, 3 in the superior lobe, 2 in the middle lobe, and 5 in the inferior lobe.
In superior lobe present apical segment, posterior segment, anterior segment.
In middle lobe present a lateral segment, medial segment.
And the inferior lobe contains superior segment, medial basal segment, anterior basal segment, lateral basal segment, posterior basal segment.
We completed the second essay question.
Yes, then see you all tomorrow.